BPH, or enlarged prostate, affects more than 40 million men each year. In fact, men over 50 have a 50% chance of having BPH. Dr. Kuang treats men with this condition, and he's here to discuss what he does and maybe some solutions to this, non-surgical solutions. Is that right?
That's correct.
All right, so let's first start off sort of defining what BPH, enlarged prostate, is and why it is so dangerous for men.
So the prostate is that man organ that sits underneath the bladder, and it's shaped like a donut. And as we get older as men, that prostate's going to get bigger, and as it does that, the donut hole starts to get tighter. It's almost like curtains coming down like this, and so now guys are peeing through a slit instead of a hole. So guys start having urgency, frequency, decreased flow, problems emptying. Sometimes, probably the biggest thing, guys are coming, hey doc, I just want to be able to play 9 holes of golf without having to find a bathroom, twice.
So that really is kind of the first sort of symptom that we're dealing with an enlarged prostate. Is that right? Frequent needs to urinate?
Exactly, but even more so at night. Guys are getting up 2, 3, 4, 5, 6 times a night, having poor sleep, feeling fatigued the whole next day, and it's affecting now their wife's or their partner's sleep as well. And if guys ignore this, it's kind of like if you had chest pain. Would you ignore chest pain? It might be a heart attack, heart failure. Same thing when it comes to the bladder and the prostate. It's signs that if you don't ignore it, you might lead to either not being able to pee at all or even go into bladder failure.
Wow, okay, that is scary stuff. All right, so we're talking about this UroLift treatment, is that right?
Correct, the
UroLift
system.
So tell us a little bit about this.
So a lot of guys, up until now, it was either medications or surgery, major surgery. And the problem with medications, guys don't want to be paying money for chemicals and drugs in our body. There's a movement of guys wanting to be clean living. Also, there's side effects, sexual dysfunction, dizziness, lightheadedness. So that's where UroLift system comes in. It's minimally invasive, it's in the office, local anesthesia, guys who need more, they might have manesthesia, that's nitrous oxide, laughing gas like in the dentist. Takes about an hour of your time, and what we're able to do is take these tiny little implants, and now we're able to open up those curtains of the prostate, so now guys can pee more freely. 90% of guys leave the office without a catheter, 99% maintain their sexual function, little urgency, frequency, some blood, for about 2 to 4 weeks. But it's really important guys hear it from other guys. If guys visit our website, our YouTube channel, hear it from other guys who've been through the UroLift experience.
And I think another thing too, we'd spoken about the medication, and a lot of people don't want to do that. The other thing, and you mentioned, I think is very important, minimally invasive, because the other option, surgery, a lot of people are scared about that. So going under the knife, going under a general anesthesia, I know for me is very scary. So having this opportunity to be able to do something that seems to be, we come in, we have the procedure, and get us out the door, that seems to be something that we can live with a little easier and a little less frightening, to be frank.
Oh, exactly. I mean, major surgeries are general anesthesia, a catheter, sexual dysfunction, bleeding, infection. Those things are really scary for major surgeries.
So if someone out there watching, say they themselves are dealing with this, or maybe their loved one, maybe it is a spouse, and they're concerned about their husband maybe getting up, using the bathroom frequently.
Well, the spouse wants more sleep.
Yeah, exactly. She's like, please, someone do something about this. How do we get the process going to find out more about the UroLift and maybe scheduling a procedure?
Well, folks can call us at our, at our MD for Men, actually 433-4665, things like. Visit our YouTube. Really, I think that's really important. See what other men are talking about in regards to their experience to understand the process. There's UroLift.com. There's a lot of different resources, and really, most importantly, is that guys realize there is a solution. Too many men are hiding in the shadows with this problem, and realizing, hey, talk to your primary physician, talk to your urologist, your men's health specialist, to realize there is hope, there are solutions, there are alternatives other than medications in major surgery.
Absolutely. Doctor, thank you so much for bringing this information in. Greatly appreciate it.